Tinea refers to a group of fungal infections that commonly affect the skin, nails, and scalp. Despite its name, ringworm is not caused by a worm but rather by different species of fungi called dermatophytes. These fungi thrive in warm and moist environments, such as locker rooms, swimming pools, and communal showers. In this video, we will explore Tinea overview, causes, sign and symptoms, diagnosis, treatment, home remedies, and frequently asked questions. By the way, welcome to our channel. Don't forget to thumb up and subscribe. Types of Tinea infection. There are several types of Tinea infections, each affecting different areas of the body. The most common types include Tinea corporis. It affects the body, causing itchy and red circular patches. Tinea pedis. Also known as athlete's foot, it affects the feet, causing itching, peeling, and cracking of the skin. Tinea cruris. Commonly known as jock itch, it affects the groin area, causing redness, itching, and a rash. Tinea capitis. It affects the scalp, resulting in hair loss, scaling, and sometimes, pus-filled lesions. Tinea unguium. Also called onychomycosis, it affects the nails, causing them to become thick, discolored, and brittle. Causes of Tinea. Fungal sources. Tinea infections are primarily caused by dermatophytes, which are fungi that feed on keratin, a protein found in the skin, hair, and nails. The fungi thrive in warm and humid environments and can be transmitted through direct contact with an infected person, animal, or contaminated surfaces, such as towels, clothing, or bedding. Risk factors. Certain factors increase the risk of developing Tinea infections. These include poor hygiene practices, sweating excessively, living in crowded or communal areas, wearing tight-fitting clothing or shoes, having a weakened immune system, participating in sports that involve close physical contact. In Uyghur medicine, the causes of Tinea are attributed to an imbalance in the body's nature and blood, allowing external pathogenic factors like dampness, heat to invade the skin's nature. These pathogenic factors disrupt the body's natural harmony and contribute to the development of Tinea. Treatment aims to address these imbalances and clear the pathogenic factors through herbal remedies, dietary adjustments, and external applications. Signs and symptoms of Tinea. The symptoms of Tinea can vary depending on the type of infection and the area of the body affected. However, there are some common signs and symptoms that may indicate a Tinea infection, including red, itchy patches on the skin, circular or ring-shaped rashes, scaling or flaking of the skin, swelling and inflammation, blisters or pustules filled with fluid, cracked or brittle nails, hair loss in the affected area, in case of scalp involvement. There are specific symptoms for different types of Tinea. Each type of Tinea infection may also present with specific symptoms. Tinea corporis. Circular or oval-shaped patches with a raised, scaly border and clear center. Tinea pedis. Itchy, red, and peeling skin between the toes, along with a burning sensation and an unpleasant odor. Tinea cruris. Red, itchy rash in the groin area, inner thighs, and buttocks, often with a distinct border. Tinea capitis. Patchy hair loss, scaling, and inflammation on the scalp, accompanied by itching and sometimes swollen lymph nodes. Tinea unguium. Thickened, discolored, and brittle nails that may become yellow, white, or brownish. Diagnosis of Tinea. To diagnose Tinea, a healthcare professional will typically perform the following. Physical examination. The doctor will examine the affected area and look for characteristic signs of Tinea, such as redness, scaling, or circular rashes. They may also ask about your symptoms and medical history to gather more information. Laboratory tests. In some cases, the doctor may take a sample of the affected skin, hair, or nail for further analysis. This can involve a microscopic examination or a fungal culture to identify the specific fungus causing the infection. Treatment of tinea. Treatment options for tinea, or ringworm, depend on the severity and location of the infection. The goal of treatment is to eliminate the fungal infection and alleviate symptoms. Here are some common treatment options. Topical antifungal medications. These medications are available in the form of creams, ointments, lotions, or powders. They are applied directly to the affected area and work by killing or inhibiting the growth of the fungus. Common topical antifungals include clotrimazole, miconazole, and terbinafine. Oral antifungal medications. In more severe or widespread cases of tinea, oral antifungal medications may be prescribed. These medications are taken by mouth and help treat the infection from within the body. Examples of oral antifungals include terbinafine, itraconazole, and fluconazole. Oral medications are often recommended for tinea capitis or extensive tinea corporis. Antifungal shampoos. For tinea infections affecting the scalp, antifungal shampoos containing ingredients like ketoconazole or selenium sulfide may be recommended. These shampoos are used regularly to help eliminate the fungus from the scalp. It is important to consult a healthcare professional for an accurate diagnosis and to determine the most appropriate treatment plan for tinea. They can provide personalized recommendations based on the specific type and severity of the infection. Home remedies for tinea. In addition to medical treatments, certain home remedies can complement the management of tinea. These include keeping the affected area clean and dry, avoiding sharing personal items like towels or clothing, wearing loose-fitting clothing made of breathable fabrics, using antifungal powders or sprays on the feet, practicing good foot hygiene, especially in public areas. Prevention of tinea infections can be achieved by following good hygiene practices, keeping the skin dry, wearing clean and breathable clothing, and avoiding direct contact with infected individuals or contaminated surfaces. Frequently asked questions about tinea. Can tinea be transmitted from animals to humans? Yes. Tinea can be transmitted from animals to humans. Certain animals, such as dogs, cats, and farm animals, can carry fungi that cause tinea. Direct contact with infected animals or contaminated surfaces can lead to fungal transmission. How long does it take for tinea to clear up with treatment? How long does it take for tinea to clear up with treatment? The duration of treatment for tinea depends on various factors, including the type and severity of the infection, as well as individual response to treatment. In general, mild cases may improve within a few weeks, while more severe or extensive infections may require several weeks or even months of treatment. Can tinea affect the scalp? Yes. Tinea can affect the scalp and is known as tinea capitis. It is more common in children and may lead to hair loss, scaling, and inflammation of the affected area. Treatment for tinea capitis usually requires oral antifungal medications prescribed by a healthcare professional. Is tinea a contagious condition? Yes. Tinea is a contagious condition. It can spread through direct contact with an infected person, animal, or contaminated surfaces. It's important to take precautions, maintain good hygiene, and avoid sharing personal items to prevent the spread of tinea. Thanks for watching. Take care and stay safe.